How you doing? It's Dr. Chris again, aka the Stick Doc, your resident warrior chiropractor. I'm going to talk a little bit more about what we do and what you could possibly even do at home for any type of care for carpal tunnel syndrome. Before we even go on, just make sure you hit like and subscribe to our channel. So again, when you have carpal tunnel, a typical symptom for carpal tunnel is basically numbness throughout your whole hand, not the whole arm, but the whole hand. A lot of times, if you wake up in the morning, you might want to shake it out. That's a normal reaction. Even also when you work during a desk on a mouse, being in this flexed position in a chronic state could create that impingement of that median nerve going over here called the flexor retinaculum. And so I want to just show you some of the things that we could do, and you maybe could be able to do also at home for self-treatment. So stand by. Okay, here we are again. So talking about the carpal tunnel. Again, a true carpal tunnel is basically the median nerve, which you're not going to be able to see obviously on the surface of the skin, but internally it actually travels down into the actual carpal tunnel itself and innervating the rest of your hand. Typically for this carpal tunnel syndrome, you're going to have what we call a flexor retinaculum, getting more fibrotic tissue right above that median nerve and impinging on it too. Hence why your hands tend to feel pretty much numb every so often, especially when you wake up in the morning, or even after work with using the keyboard, a mouse, or even just chronic gripping. What we typically do for treating carpal tunnel here, conservative care, we do a lot of soft tissue work. So, of course, I could use a factor concept or factor technique where we use one of the instruments here. This one's called the F1. With an emollient, we may work a little bit more around the carpal tunnel area here, breaking up any fibrotic areas of the flexor retinaculum, even going up the arm itself as one aspect too. Sometimes we may even actually just do a hand hold here and just do a few stretches. Things you could do also at home if you can't see a chiropractor, physical therapist, occupational therapist, a hand specialist for example, or even acupuncturist who could also work on this too, which we could talk about later. You could also have somebody grab two parts of your hands this way with your pinky in here and here, and using your thumb, and you can even put a little bit of lotion here so it glides. And what you're going to do is go ahead and just do a light massage and just stretch and open that palm, just like this. You want to be careful about also getting right onto that area of the median nerve coming in. Although I did work along that area with the factor tool, I usually go very light. With your hands, just go right to one side here, one point, and just stretch and open. And it usually feels pretty good to the person that you're definitely working with. So you could do this several times, about 5 times or so. You could even go ahead and get into the arm itself and stretch it out, okay? Also just watch and just watch the reaction of the person you're working with, if you're actually helping them out, and just see if it's comfortable for them too. But this is something that they can definitely do. Some good exercises too with the hands, anything like a rubber band around, you could actually do some stretching exercises this way, some resisted type movement. They could even do some self-stretch this way too to open up that whole carpal tunnel, whole palm. These are some recommendations that we could try doing, okay? So once again, if you see a hand specialist or a chiropractor, physical therapist, occupational therapist, or even acupuncturist who could work on these, some things that we could do, we use the factor tool. If you don't have anybody around that you can't due to this whole pandemic, you could also get somebody to just, again, grab 2 hands, massage and open and stretch, okay? Just to help loosen up and free up that median nerve that's being entrapped here, okay? Again, if it doesn't get any better, after several times, you might definitely, you actually should consult with a healthcare provider and see what else may be needed. If you have any questions, you could definitely look us up at www.heraldsquarechiropractic.com. And again, like I said, don't forget to hit like and subscribe to our channel. Thanks again.